All right, welcome to the Medical Association of the State of Alabama's Facebook Live. My name is Aruna. I am the current president. Before we get started for this week, I would like to take a moment to acknowledge the service of two of our board member colleagues who have passed away this week. One is Dr. Patrick O'Neill, who has served on our board for a few years now and has succumbed to idiopathic pulmonary fibrosis. And our second is Dr. Jefferson Underwood, and he was our past president of the Medical Association and succumbed to his courageous battle fighting ALS. Both are true service-oriented colleagues that we are definitely going to miss. All right, so today we are gonna go ahead and start. We've got a special guest, Dr. Regina Benjamin, known to most everybody as our former US Surgeon General from the years 2009 to 13. But boy, her resume is very, very long, as we were just discussing. I'm gonna let her introduce herself when we get to that portion, but most notably to me, she has also been a president of the Medical Association. So I want to welcome her, and she is a true trailblazer to me. So we're very excited for her to be here today. And then we've got our State Health Officer, Dr. Scott Harris, and we're going to start with the usual update from Dr. Harris.
Great. Thank you very much, Dr. Arora. I appreciate the chance to join you. And also let me say welcome to Dr. Benjamin. We're very excited to have you. Thank you very much for joining the call today. But for those of you who have seen these calls, you know, we do this once a week on Thursday afternoons at 4 o'clock Central Time. It's streamed on Facebook Live and available to watch afterwards as well. So we really appreciate you joining us today so that we can talk to you and let you hear firsthand yourself from the experts that we have on this call each week, and certainly no better expert than Dr. Regina Benjamin. So I'm looking forward to this myself. I did want to give you an update about where we are. Our numbers in Alabama have continued fairly steady, which is not a good thing to report. We are having new reports each day of cases in the 3,000 to 4,000 range per day. We have had a couple of days where we've approached 5,000 new cases reported to us. That's just really a terrible number for us to have to see. Our hospitals continue to struggle. We, as of right now, have about 60 more patients in Alabama's ICU beds than we have actual beds. We have 60 more patients requiring critical care than we have actual ICU beds in the state. Now, a week ago, that number was about 100 more. So I suppose that's somewhat of an improvement, but it's still a very dire situation for many of our hospitals. The overall number of inpatients in Alabama hospitals with a diagnosis of COVID has plateaued somewhat for about a week now. We've been in the range of about 27 to 2,800. That's a huge number, but it has fortunately not continued to go up anymore. Actually, today, the report has us below 2,700 inpatients, just about 2,600 in 80 or so, which is the lowest number we've had in a couple of weeks. So perhaps we're seeing a plateau and maybe an end to the surge, but we're still not out of the woods yet. We continue to work very hard to get people vaccinated. Vaccinations remain our very best tool for protecting people's health and safety. Vaccines are the best tool we have for keeping people out of the hospital and we hope not dying from COVID-19. Alabama has seen some encouraging numbers over the past 5 to 6 weeks. We have been at or near the bottom, as you know, in the United States in terms of our ability to get people vaccinated since this began back in December, since the vaccination effort began. But we have actually moved ahead of about 8 states now in terms of people getting at least one shot. We're still very near the bottom in terms of having people fully vaccinated, but we are glad that people are coming out in increased numbers now. We hope that that will continue. I think one of the encouraging things about that is that maybe this means that we don't have people who are just categorically opposed to ever being vaccinated ever. There may be just people who, now that they've had a personal experience, Very likely they know someone who's been affected by COVID, someone in their family or community. Maybe that's motivated more people to come out and get vaccinated. So we certainly hope that continues. We still have a lot of work to do. We still have a long way to go, but we are encouraged that it's improved a little bit. Dr. Arora, I want to give one just final update on the use of monoclonal antibodies. We've talked a lot about that on these Facebook Live broadcasts each week. As our viewers know, monoclonal antibodies are one of the interventions that we have for people who are infected with COVID but aren't yet sick enough to be in the hospital. For those people who are at high risk for bad outcomes or being hospitalized, like seniors or people with chronic health problems, monoclonal antibodies are a type of medication that can be given as an IV or an injection under the skin that will reduce your chance of going into the hospital by about 70%. They're tremendously helpful and effective. In states like Alabama, where vaccination rates have been low, we have seen some people touting those as something you can do so that you don't have to get vaccinated. And that's a real unfortunate situation. But many southern states have started using very large numbers of monoclonal antibodies. And we're very glad we have this tool. It's actually they are very effective. We're very fortunate that we have people who've developed this drug for us to use for people. However, because of the unprecedented demand for monoclonals, we are seeing some issues with supply now. We had a call this past Friday with the HHS who let us know that Alabama and some other states are going to be on an allocation. We don't think providers are going to be able to order as much as they would like, which had up until last week, there was really sort of no limit to what could be ordered. So we have a lot of details we put out in a Health Alert Network message yesterday for providers around the state. I'll be glad to talk about that more later. We think this is just a shortfall that may only last into October, but as we've seen more and more people becoming monoclonal providers and more people who actually need to receive the product as patients, it's just really created a difficult issue for us. So that's really all I had, Dr. Arora, but I'll be very happy to answer any questions.
Yeah, so that, Dr. Harris, you're right. We have spent a good bit of time encouraging monoclonal antibodies, during this interval where even if patients were to get vaccinated and contract COVID, they should know that there is a potential option in terms of treatment and the time period for when they need to think about it. And so we have done that proactively here to the public. We've done it with our medical colleagues to encourage providing the medication to their patients. And so the news from the federal government on slow down to a state that is truly one of the highest, like the Gulf Coast states right now, is really somewhat, disappointing, and from what we gather, it appears to be somewhat of a bureaucratic process right now. And so we're trying to work through it. We've got members of federal Congress and Senate who are helping us deal with this and advocate for us. And so hopefully we'll just not have this issue, so that we can treat our citizens who are sick. So, well, thank you.
I'm sorry, I would just say we've had a lot of discussions with our federal partners about this. They certainly understand the situation. We do have, as you know, a lot of patients in need. Alabama has a lot of high-risk people, which creates that need. But also, we've seen that there've been some expansion in our ability to use the drug as a post-exposure prophylaxis for people who are exposed but not yet sick. But also it's one of the products has been approved for use as a subcutaneous injection or an injection under the skin as opposed to an IV infusion, which has allowed a lot of providers to start giving the drug who weren't previously able to do IV infusions. And so there's just a whole confluence of factors there, a lot of different reasons that there's just not enough to go around. But we hope that's going to be addressed in the next 3 to 4 weeks or so. So we're being told.
Absolutely. As we know, the hospitalization situation is not such that we need to put more of a burden in the hospitals. So, all right. Well, thank you, Dr. Harris, for the update. Dr. Benjamin.
Hi there.
Hi. I'll let you go ahead and introduce yourself and then we can kind of have some discussion.
So I'll take a little minute to talk about some of the things I've done, which my least favorite conversation is talking about me, but in telling you some of the things I've been involved with, perhaps it'll stimulate some questions or whatever. First and foremost, I'm a family physician, have been a family physician let me stop this phone, sorry. I've been a family physician in bioobstetrics for the past 30 years. And 22 of those years I was in solo practice. And all of that led to the fact that, I am who I am today. You know me as the 18th United States Surgeon General and as also the first person under 40 to be elected to the American Medical Association's Board of Trustees. But none of that would have been possible if I had not been involved in the Medical Association in the state of Alabama. For 14 years, I served on the Board of Censors and became the first woman president of the Medical Association and the first African-American president. But in addition to that, we also are on the State Committee of Public Health, which for those 14 years learned everything I know about public health, which really served me well as Surgeon General and as well as with the World Health Organization that I'm still involved with. In addition to that, with the Medical Association, with the Alabama Board of Medical Examiners for, again, 14 years, going on to be the Federation of State Medical Board, which is all the licensing boards in the country, and being president of that, we basically hold our profession up to a higher standard. In addition, I was the chair of the CJA for the AMA, Council on Ethical and Judicial Affairs. We use that particular council writes and maintains the code of ethics for the profession of medicine. And we use that code of ethics to license and discipline physicians throughout the country. And so all of that, I say thank you because I got all of my basics here at the Medical Association. Today, I'm still involved with everything that you can imagine. I serve on the Lancet Commission on COVID. We are a group of scientists that follow the data, follow the information. White House advisor with the other surgeons generals, and the National Advisory Council for the COVID Collaborative, which is a group of organizations and whatever. So I keep my fingers in the middle of everything. And if you have some questions or whatever around those things. But I want to just talk about being a doctor just for a minute. I know we have others on this call, but I want to speak to the physicians. The first part of COVID, I spent the first year just trying my best to keep people alive and keep them safe and give them the information and the tools that they could use to stay safe until we got a vaccine available. The 3 W's, wear your mask, wash your hands, and watch your distance. And we were able to do that. And now we've transitioned to trying to help people keep themselves alive and keep their families safe by encouraging them and trying to get them to get themselves and their families vaccinated. And it's becoming, so difficult. It's been a year and a half, almost 2 years. And we're seeing our doctors, and when I say doctors, I'm also including the other health professionals, our nurses, our other medical professionals, that compassion fatigue is kind of setting in. And so regardless of that, they will, and we will take care of you no matter what. When you come in our facilities, you come to us, we're going to take care of you. But I want to remind our doctors that as physicians, our patients trust us. And that's the most sacred thing that we have. A mother will put her infant baby in your hands, a perfect stranger she's never seen before, simply because she trusts you. And your hands are often the first hands that a baby feels when they enter this earth. And your same hands may be the last hands that an elderly person may feel as they leave this earth. We are truly blessed as a profession. And I just want to make sure we remember that. But with that blessing comes responsibility. And we have the responsibility to make sure that our patients are treated with our best abilities. And first, we do no harm. We use scientific information. We know the scientific method. We don't do antidotes. We, as a profession, know how to do that. And I just want to make sure that our clinicians and our doctors and our nurses and our other medical professionals know that we appreciate what you're doing, and yet we are also very blessed to be able to do it. And I'm going to stop there because I could go on and on with this, and we can talk about it, any part of this topic of COVID that you'd like to talk about.
Well, that is a wonderful perspective for sure. I think the fact that you practice, I think one of the greatest things about after you served as Surgeon General is the fact that you came back to your own, hometown, and you continued to do what you do best, which is rural medicine and taking care of the underserved. And so really, I would love to hear some of your messaging to patients in the rural community and how you have tackled vaccine hesitancy. That is a big topic that I feel like is always a challenge, when you are a physician.
It is a challenge, and we've done the best we're still trying to do the best we can. The best thing is just to listen and listen to patients when they have real concerns, particularly about misinformation. We try to clear it up. We work through the Mobile County Medical Society with the current president there, and work with the Black churches early on last year to get understanding, and we did some testing clinics in the church parking lots, and building up that trust, because that trust is what's been eroded. And so we want to make sure that we are a trusted source and that we're not going to do anything that's going to harm anyone. So when it comes to patients one-on-one, listen first. And it's ultimately their decision, but we give them good information. And if we don't know something, say you don't know it, but you will find out. And I will never tell anyone to do anything that will harm them. And that's all I can say to them. And then that's what I do.
I think that's really powerful, because if you don't have trust, patients have a hard time being vulnerable to you and describing their situations appropriately and accurately. And right now in all of our communities, I think the vulnerability is what we are missing. I think, when we are able to have conversations based on trust, you're able to share and have the appropriate compassion, as opposed to locking down behind a belief that you may have seen somewhere, and it's like two people, holding their ground. It's not a conversation when it doesn't come from a place of love. So that is very, very important. Can you describe some of your background as Surgeon General and, at the federal level, how some of, the vaccines have come to fruition to the point that we now have vaccines? Can you describe some of that with the background that you have had?
So, there's a lot of information out there on how they came about. And we're in the scientific world, we're very proud of the fact that we were able to work to get this vaccine out quickly. But it really wasn't quickly. It was 10 years of developing the platform to develop these vaccines on. When I was in office, we had H1N1, and we started developing these platforms. And so when COVID happened, we had a platform and a basis to build on. So we were able to have that jump start, and we were able to bring it. However, everything shut down, and every scientist almost in the world started working on this vaccine. And so we're very proud of how fast we brought it. It wasn't like it was done in any unsafe way. It's just that we all concentrated on nothing but that vaccine. And so we're proud of that. Some people think of it, well, it was too quick. Well, people were dying. And so we did it as quick as we can. So I'm very proud of the way it was done. In the US, we have strict standards. And so we, in spite of the fact that we have a lot of information and data and science behind it, we will use the same processes before we make something completely licensed and completely fully accredited, or whatever the word is. I'm missing the word here, but that's why we had emergency use for the vaccine in the beginning, until we had at least 6 to 8 months of information to look back and say, this is what we saw. And we have more information on this vaccines than we have on any in the past. And so then it became fully, what is the word, Dr. Harris? It's not
It's
accredited.
fully approved by
Fully
FDA.
approved.
Yeah.
Yeah, that word. Yeah. So the process, and what's different with the United States is that you see some other countries where you have contaminants, you have other things. We don't have that here because we have such a strict amount. And you also see it in other medicines where people say, well, why are medications and things so much more expensive in the US? Because they have to go through those processes.
Right.
And it's for the safety and protection of the public.
Yeah, okay. When you are talking to your patients and they are trying to figure out how they can best prepare or prevent COVID other than the vaccine, what kind of preventative advice do you give them?
I think the more simple, the better, the least things. We all know what to do. We've told you, we know it, we've been telling you for years. And it's so simple that people don't want to take it. And it's those 3 W's. First, you get vaccinated, and then you wear your mask, wash your hands, and watch where you stand, watch your distance. Those 3 W's, those things will protect you and your family. And everything else is just extra, you know.
Yeah, absolutely. How about, if a patient has COVID and they are looking for some sorts of things to do treatment-wise in the outpatient setting?
Get vaccinated.
And if they have had COVID and they're currently with a COVID infection.
And you basically do the things that you would do for any other cold or whatever, but talk to your doctors, contact your health professional, your doctor, your nurse practitioner, just stay in touch with them because, this still is a new virus. And so it's changing, it's mutating. And so it's constantly changing and nobody can stay up to date every minute. So stay in touch with your clinicians, your doctors and your nurses. So.
Yeah, I think that is an important message. A lot of times, that relationship that you have with your doctor is what will help you through the various scenarios that are out there on how to treat COVID. And there are several out there.
I would like to go back a little bit to that misinformation that you mentioned. There is a lot of misinformation out there, but there's also disinformation. And I don't want to not acknowledge that fact that there is information that is wrong information that is put out there on purpose. And that information is there for one purpose only, and that is to erode trust. It's to erode trust in everything, everything from the media, from the church, from the policemen. We don't even believe in cowboys anymore. I mean, everything that you ever believed in has been eroded so that you trust nothing. And that causes an unstable society. And so there are really bad actors out there who are trying to use us, use our fears to make us mistrust. Make sure you find a trusted source and that you really know, you've known for years, not an overnight person or no overnight email that comes across. Find a trusted source to get your information because you're not going to be the only person that they're going to share that information with when the rest of the world doesn't know it. Why would they choose you to give you the only person the information? One thing we have in Alabama, if nothing else, is we have common sense. And many of the people are forgetting that that's what we have, and we need to go back to using our common sense.
That is a very good point. We have common sense. I think the most important thing to understand is you don't need all the levels of education in science to understand the principles that we are talking about. The public health preventative principles that we stress every week are things that our children could even tell us, so that is a very good point. Okay, I have a question that has come through here. Many people in underserved communities do not have a primary care physician. So how can they find someone to trust?
That's very true. And we're working really hard to get particularly young people to go into health careers. And so if you know somebody, encourage them to go into health careers because we really need them. But in the meantime, the doctors and the nurses that you know, we have county medical societies that you can contact. We also have our health departments, and our county health departments are local, and they can get you in touch with someone. And if nothing else, contact Dr. Harris or the Medical Association State of Alabama, and we will try to find you somebody that will be in touch with you.
Yeah, that is a very good point that you made about young professionals going into the field. Not just young professionals, but we are lacking African-American physicians, you know, for our state. And so
and for the country. And you know, in the United States, less than 40% of the population is minority, less than 7% of the physicians are minority in this country. And it was the same percentage as during the Flexner report of 1910. So we need to encourage young people to go into health careers. We're doing a very good job at UAB, but we could do better around the entire country. And when I say minorities, I'm including rural students from rural communities, because we're just as minority as any other ethnic group, because they don't have the same exposure or opportunities.
I think you hit it on the nose there. It's essentially rural doctors. We don't have enough.
Mm-hmm.
We don't have enough African-American doctors. And so when you're talking about being a patient and having that rapport and that trust, that is so important for the actual care of your hypertension or your diabetes or your obesity and nutritional habits. You can't do that without actually identifying with somebody and relating with somebody. And so we have to think about that conscientiously when we're thinking about patients who are hesitant and nervous to make these big leaps, like with the COVID vaccine.
And we also see a lot of patients who are, I mean, people, not necessarily patients, who are angry. You see the anger around the mask and all of that. Sometimes that's fear. A lot of that's fear. And we can be patient about it, because when you don't know, you're scared and you lash out. And as physicians, we're used to experiencing that, but a lot of people aren't. A lot of folks that are in the public places, they're not used to that. And so you're having public servants being treated poorly.
Right.
Stand up for them, and they don't, you know, these folks are doing their jobs, and we need to help them, and we need to support them and as much as we can, because they're just doing their jobs.
That is absolutely right. Our essential workers have to go to work.
Mm-hmm.
You know, they don't have the option of not going to work. And so us wearing a mask, you know, keeps everybody safe and keeps people, you know, at their job where they need, you know, to be able to feed their families and take care of their lives and not have their children in quarantine, because where would the children go? I mean,
So I'm gonna stare off and not be so correct, and then just give you my opinion about this argument with the mask. I think, you know, people will say it's about your rights, and I think we all have rights, and we do have rights, and our actions also have consequences. So if we're gonna do that, your rights extend to you, and you have a right to do something, but you don't have a right to put me at risk. You don't have a right to put my life at risk. I give you as a society, we give you a driver's license. You have a right to drive. You don't have a right to drive 100 miles an hour down the interstate in the wrong direction. It has consequences. The same thing when it comes to a mask, you know, and as doctors, and I'll tell you that doctors that are out there, we don't wear a mask in the operating room just for ourselves. We wear a mask to keep that space sterile, that we don't contaminate that wound. We're wearing it for the other people. And that's what we're asking you to do as well. Wear it for the others, not just for yourself.
That is a very good point. Somebody has asked for advice and concern regarding attendance at college football games. We're in the middle of college football season. It is Alabama. You know,
So I've been very disappointed in the cavalier attitude that we have around. We see this every day. We see the deaths. We see the number of people dying every day, and the number of people have died in our state. And we sign those death certificates, but the rest of the people may not see that. But you're seeing more and more of your friends and your family getting sick and dying, and yet we're still cavalier. And we're pretending that it doesn't exist is not going to make it go away. We want it to go away. We're all getting very tired of it, but it will never go away if we don't take it seriously. And we will constantly be saying, you have my thoughts and prayers, because we are getting sick. And when we start seeing our children die of these things when they don't have to. You know, we even have our own doctors who have died, and they could be here with us right now had they got vaccinated. We shouldn't have that. And so you can hear my frustration in that. We really should. I love football, and if we could take COVID as serious as we take football, we could win the COVID. We could be the winning team against COVID, but we're not taking it seriously.
That is a very good way to put it. Yeah, if we took it as seriously as we took football, we could potentially be behind this, you know, because we have got to get ourselves vaccinated in order to move forward. You know, the monoclonals, we've said this over and over, they are not the solution to the other side of the bridge. You know, we just have to get vaccinated. So any comments to some of the medications that are out there? I know you spoke about misinformation and disinformation, and having been, you know, the ultimate leader at the federation level for the state medical boards in our country, they have come out pretty strong on various key messages, as have several certifying boards now.
So basically, don't take your horse's medicine. You know, you're not a horse. Don't take the medicine. We've got, I said, we have common sense. Why would you go spend your money on a horse's pill when you could get a free vaccination? It just doesn't make any sense. And so all you can do is say, if somebody tells you go take a horse's pill, you might want to think twice about why that person's telling you that.
Yeah. I think with the amount of expertise that you have in preventative medicine and messaging, as well as your own personal experiences of family members, you know, who have had medical conditions, and how that has been the passion for you. I think the way you are so plainly saying some of this messaging, I hope it's resonating with the people listening. You know,
I hope so too.
It really shouldn't be this complicated. It really shouldn't, you know.
Right. I've got family members I'm still preaching to, trying to get them to get vaccinated. So everybody's not going to listen. And I will ask them again, please get vaccinated. But still, I mean, all we can do is try. It's like we diagnose you as a doctor, as a family doctor, diagnose you. I give you a prescription, and I can give you the prescription and tell you you need to take it. I can't make you take it. And I'm not wishy-washy about it. I'm not saying it's your opinion. If you're a type 1 diabetic and I say your blood sugar is high and you need to take insulin, I don't say take it if you want to. I say take the insulin. It will save your life. So that's the same thing with this. We're trying to do what we can to help you save your life.
Okay, so there is a question. Dr. Harris, can you explain allocation of, I don't see the rest of that, allocation of what and how it could affect Alabama more?
I would think that's about the monoclonal products.
Okay.
Yeah. So we learned this past Friday that our state is not going to receive all of the monoclonal products that are being ordered. You know, right now providers have the ability to order exactly what they want, as often as they want, how much they want. Alabama has done a great job with monoclonals. We gave our first products back in November last year. And as you know, Dr. Arora, the Medical Association has done a lot of education with providers and education with the public about that. So we been very fortunate to have that option for people to try to keep them out of the hospital. But because of the increased demand, HHS has set some new rules in place that simply say Ordering needs to be done by providers once a week. You need to order what you think will be the weekly amount that you need. And then ultimately they're going to determine what gets sent based on what the available supply is. And they estimated that most providers are probably going to get about 70% of what they had. It's a little hard to understand their explanation because they say there's not actually a product shortage, but they're trying to make sure that any product that hasn't been used that's on the shelf here is getting used. And but any way you look at it as a provider, you're not going to get as much as you order. So there is an allocation there, but hopefully that'll be straightened out in the next 3 or 4 weeks, we think.
And I would add that there are patients out there who don't realize that there is a treatment because they're being told in urgent care places, well, there's nothing we can do. We can tell them that if you get a fever and you start having more and more serious symptoms, there is a treatment to get. And we don't want you to sit at home and not get the treatment because of this possible allocation. They may change those allocations tomorrow. We may, and many of us are going to be pushing for that we get out as much as we can. We don't need to stockpile it. We need to treat people. And in a place like Alabama, where we're having more and more sick people, that's where we need the medicine. We need it here. We don't need it waiting until they get sick. It's almost like treat a heart attack before it happens, not after.
100%. Totally agree with that, Dr. Benjamin. I mean, right now is when we need the monoclonal. And so we are certainly fighting hard. We've got Senator Tuberville, we've got Representative Palmer, we've got multiple people kind of fighting this battle to try to get the monoclonals so that, when patients need this, they will have this.
I also want to just make sure we say that we don't have a shortage right now. So don't give out the impression that there's a shortage. We're just, I think, Dr. Harris, you're trying to make sure that people, the doctors in particular, are aware that if you don't get your full allotment, you know why.
Right.
And that you're, to make sure that we were also proposing that you get it prophylactically, and that we may want to hold a little bit on the prophylactic for a week or so and give it to people who start to have symptoms.
And the ones who do have symptoms, if they go home from seeing their doctor and they get worse, they really need to come back within the right window. I feel like we hear that story too much. Well, my doctor told me not to. My doctor said I was fine. Well, if things change, the equation is different. And so please make sure you advocate for that monoclonal antibody.
And I also ask people if they can, if they can have access to it or they can afford it, to check their pulse ox with your finger oxygen levels. And if it starts to drop, I don't care if you're feeling good, come on and see us right away.
100%. That is a great piece of information. Any last comments? Dr. Harris, do you want to comment on schools and cases, over this past week?
Sure. We continue to have a real problem in our schools. As you know, this past week, I think we had more than 9,000 cases in schools. A year ago, we had something less than 2,000 cases in the same week. And it was a different situation. A lot of kids were going to school virtually at that time compared with now. And of course, Delta is so much more infectious. We're not surprised to see an increase, but it's led to mask requirements and it's estimated more than 90% of our schools. Thankfully, we continue to support fully universal masking in our K through 12 schools. We are really appreciative of most of the school boards in the state who've agreed to follow that policy, to implement that policy. We think that's a great way to keep safe, not just our students, but also our educators as well. Okay. Because of the sheer numbers of cases we're seeing, many schools are going virtual for a while. Some have closed for a couple of weeks, some have closed indefinitely, and hopefully that won't be a long-lasting thing. But it's really vital for parents to understand if your child is 12 years of age or up, they are eligible to get vaccinated in just about every case, and please try to get them vaccinated as soon as possible. If you get vaccinated today, we want you to do that, and yet depending on if you're a child, you're 12 and up, you're going to probably get the Pfizer product, which means you need another shot in 3 weeks. You need a couple of more weeks to really develop full immunity based on those 2 shots. So what you do today really is going to be most beneficial 5 or 6 weeks down the road. And we really don't want to wait a long time. We want to get this going as quickly as possible. It's really important to have kids in school for face-to-face instruction. We all saw last year all the issues that happen when they're not. And yet we also have to make sure they're in a safe environment. We want our kids to be healthy and our educators as well.
I want to take that a little further and say, get your vaccines now, because we want you to be fully vaccinated by the time we go into the holiday season, till we get to Thanksgiving and Christmas, so we can be together. And it's like you're preparing for Christmas. And so you can't get you're just getting ready for it. The other thing I wanted to just mention, just because I had a number of people ask me, particularly physicians, and ask me, well, with the vaccine, isn't it just the pharmaceutical companies trying to make money? And I think that's kind of crazy, in that the pharmaceutical companies were paid before the vaccine was made. They got paid ahead of time. They've already been paid. So they don't care if we take these vaccines or not, because they've already gotten paid. This is us. We're the ones that have to take care of ourselves.
That's a really good point. Because I have heard that as well. And I've heard that in regards to boosters coming up. And so that's a really good point that you made.
And one thing we didn't talk about, and it's important because we're a part of the entire world, is that there are countries that are, and I get calls from every week about, they are begging for vaccines, and we're having vaccines expiring on the shelf. These countries would do anything to just get some vials of medicine in their country so that they can give their citizens of vaccinations. And yet, as a global citizen, we need to think about it, of what we can do to help the world as well.
That is a very good point. I was born in India. I lived in the Middle East, and I lived all over the US and traveled the world. And so global is very easy for me to understand, but for people who don't understand the concept of global, or it may not be significant to them, I still urge them to just think about the fact that if we don't vaccinate the rest of the world, this will continue to be our problem. The Delta variant did not originate here in the United States. It originated in a country that had low vaccination, and now that variant is all over. And so for us to actually move forward, we do actually, in a global pandemic, need to globally vaccinate the entire world.
But even if people don't understand that concept, many of our viewers here are Christians, and they understand what it's like to have a Christian perspective and do for your brothers and those who are less fortunate.
And that is beautiful. That right there, that's what really truly encapsulates Alabamians. Alabamians, when they are driven by their faith and their mission and their community and their neighbors and football, the most beautiful things happen in our state. And if we could just channel that energy, I say that every time, but truly believe it, I think we would really do magical things.
So
Well,
Dr. Arora, that brings me to a point. Can I end with a poem?
Yes, please do.
And that just made me think of this poem. And it's many of you probably heard it, but it's entitled God Minute. And it goes like this: I have only just a minute, only 60 seconds in it. Forced upon me, can't refuse it, didn't seek it, didn't choose it, but it's up to me to use it. I must suffer if I lose it, give account if I abuse it. Just a tiny little minute, yet eternity is in it. We should all take our God minute and make a difference.
Oh, so beautiful. Thank you, Dr. Benjamin. That's a beautiful way to end. Very grateful for both of you, and thank you again.
Thank you.
And thank you both, and thank you, Dr. Harris, for representing our state so well.
Thank you. Thank you very much.